waiting to go live. Yes, I think people have joined in. Are we live? Should we start? Rakesh? Okay.
Yeah.
A very good evening to all these FMG aspirants who are preparing for the exam. And now the notification came out a week back, and I hope all of you are in good spirit. This is the time to press the accelerator, but this is also the time where you might be feeling anxious. Ki how to go about it? Because the next 70, 80 days are going to decide whether you cross the line or not and how efficiently you cross the line. And if you are feeling jitters, if you're having any doubts regarding your preparation and how to plan those next 80 days strategy and common mistakes to avoid, we at DocTutorials, the entire team is here to help you out. I'm Dr. Sandeep Sharma, the pediatric faculty, and I'm joined by the legends over here. These legends do not need any introduction. We have Dr. Rajiv Dhawan sir, your favorite faculty, mentor, life guru, chief strategizer, all put into one. And then we have the young, dynamic, and our biochemistry faculty, and in your offline, the medicine faculty also, Dr. Priyansh Jain with us. And very shortly, we'll be joined by Dr. Khalil Ahmed sir and Nadeem sir also. They are traveling, but they'll be joining us shortly. So, welcome everyone. And let me start with asking Dr. Rajiv Dhawan sir with the first question. Sir, 80 days to go. How should we go about it if I'm an FMG aspirant?
Thank you very much, sir. First of all, I think we should be thankful to NB for giving us 2 extra weeks. Now, these 2 extra weeks can go both ways. People can take it easy. There's a lot of time left. Or the other way is that to fill up the whatever deficiency we have in our preparation. First question is 80-day time period is sufficient to crack the exam? The answer is, with the grace of God, blessing of parents, we can make it happen. If you are sincerely working for these 80 days, there are very high chances that you can really make this exam happen for yourself positively. How would I recommend that, how would be my strategy, like 80 days? I would say 2 revisions and one last leg of revision from 16th to 25th of July. 16th July to 25th July, last 9 days, don't keep it that. Before that, let us do 2 proper revisions. And the only request is that after talking to so many students who scored 200 plus last time, one common factor has been that they have been keeping one window exclusively reserved for MCQ based study. The most important message from my side to each one of you will be, please do not just do theory, do not just do PYQs. Whenever you design the custom modules in the QBank, always keep the challenge level higher. But 60-40 should be the right proportion in the second revision. In the first revision, if you're a first timer, I can understand that you have to read the theory a lot. But in the second revision and onwards, 60-40 is the distribution of time between the theory 60 and 40 is MCQ based study. And the second thing I would like to say, do not forget the grand test. How many grand tests shall I give? Minimum to minimum in these remaining 80 days. Even if we take 1 GT per 10 days, it means 8 GTs should be given before the final exam is, like in front of you. So may I summarize what I said till now? 2 revisions before 15 July, then 16 July to 25th July, one last leg of revision. Number 2, the proportional distribution of the question should be theory versus question is 60-40. Do not just do theory, do not just do the PYQs. Keep NEET PG question also part of that so that you get the challenge level high. Thirdly, 8 GT should be given in the 80 days before the final exam. Sandeep sir.
Very aptly said, sir. Sir has given some very good suggestions. All of you who are listening to this session, you can ask about your doubts. And this video will also go up on the DocTutorials YouTube channel. So you can see it again and you can make the points as sir is summarizing. Next, I move to Dr. Priyansh, sir. Dr. Priyansh, how to cover medicine-like subjects, number 1, and what to do with the first-year subjects. Sir, first of all, please talk about medicine, the biggest problem for the students, and then how to tackle first-year subjects. Over to you, sir.
So I would suggest first it's 80 days if it's good enough time to do the things provided that कि इन्होंने and सब कोशिश तो कर ही रहे हैं सर सबको पास होना है so they are working very hard for the last few months. It is the time to consolidate the things. Don't run for the content. That is very important here and there. बहुत सारी चीजें आएगी यहाँ पे वहाँ पे इधर उधर. Don't go for there. Your gold is with you. That is your notes. Stick to them. Read them multiple times. There will be a days where you will feel कि कुछ याद नहीं आ रहा है सब भूल रहे हो. ऐसा सबके साथ होता है. Don't worry about that. Just you continue to flip the pages. Now, coming to the subject wise, I would suggest you divide your subject into three parts. Uh, I would say 12 plus 5 plus 2. Now, what does that mean? इस एग्जाम में अगर किसी के 12 सब्जेक्ट 12 सब्जेक्ट्स इफ दे आर वेरी गुड मतलब कि नोट्स अगर क्वेश्चन आएगा वेरी गुड द डेफिनेशन फॉर मी इज इफ द क्वेश्चन विल कम फ्रॉम नोट्स इट विल नॉट गो रॉन्ग अगर हमारे 12 सब्जेक्ट्स इतने अच्छे हैं then definitely we have cleared the exam. Now all the 19 subjects cannot be taken to a same level for every individual. किसी के कुछ अच्छे होंगे कुछ खराब होंगे तो 12 सब्जेक्ट आप बहुत अच्छे करिए irrespective of the name or the size or the weightage of the subject. Now coming to the remaining 5 subjects, the 5 subjects you do the notes, you do some MCQs, you may not be feeling good with some particular pages in those notes. Don't worry about those pages. कोई particular topic नहीं समझ में आ रहा है उसको छोड़ दो and just see that कि जब टीचर ने वो टॉपिक पढ़ाया for example any XYZ say for example cardiomyopathy if you are not feeling comfortable in that and what the teacher has told you that कि यार ये word आएगा ना ये आंसर है ये आएगा ये आंसर just read that and skip that topic. Now it's not the time कि हम we invest a lot of energy in those topics to understand them. It's okay. ऐसा नहीं कि पेपर पूरा वहीं से बनने वाला है ना. So and we don't have to score 300 out of 300. So it's okay to skip some part from those 5 subjects. Now coming to the last 2 subjects, it may be any subjects which I feel that everyone has some fear of 1 or 2 subjects कि यार ये तो बिल्कुल ही याद नहीं होता. It's too difficult for me. Maybe it is biochem, maybe it is pharma, maybe micro. Particularly these are the subjects जो को लगता है कि बहुत रटना पड़ रहा है. What you do is for those 2 subjects every day spare 30 minutes. अगर कोई से भी 2 सब्जेक्ट्स है इट्स नॉट ऑलवेज टू बी बायोकेम और एनी अदर सब्जेक्ट कैन बी एनी सब्जेक्ट्स स्पेयर 30 मिनट्स फॉर दोस 2 सब्जेक्ट्स और इन दीज 80 डेज वॉट एवर इज गोइंग टू हैपन 30 मिनट्स दोनों सब्जेक्ट पढ़ेंगे 80 डेज में जितना होना है उतना हो जाएगा so the idea is very simple it has to be 12 plus 5 plus 2 plus as sir said Rajiv sir ki don't afraid of giving GTs give GTs and many of you are asking ki sir GT का score कैसे बढ़ाए see idea is very simple ki GT score, there is no trick. It's simple. You have knowledge, then the score will improve. So we have to work on that knowledge. We have to work on the concept building part. Plus, the one small mistake that many of us are doing is while giving the GTs, we are just focusing कि वो जो last के 50 क्वेश्चन होते हैं ना 30 क्वेश्चंस there is a temptation कि फटाफट मैं fill करूं और मेरे को स्कोर देखना है कि whether I have crossed 180 or not. This is what I am feeling. तो आप उसके लिए मत जाओ. Try to do the GT for 2-3 reasons. One, the 50-minute slot has to be completed in 40 minutes because अगर यहाँ पे आप 40 मिनट में कर रहे हो तो एग्जाम में it will take 50 minutes. The reason being कि आप ओवर कॉशियस हो जाते हो एग्जाम में ज्यादा पढ़ते हो बार बार पढ़ते हो तो it takes more time. So यहाँ पे 40 लग रहा है तो वहाँ 50 लगेगा. So try to finish in 40 minutes here in the when you are giving GTs. Second, when you analyze the GT, try to see कि कितने क्वेश्चन आपको आते आते आपने गलत किए. So that number we have to bring in single digit. Those what you call as a silly mistake. अगर वो single digit में आ जाएगा तो काफी कुछ हमारा burden कम हो जाएगा. And lastly, the temptation that comes of changing the answer. See, when to change the answer, when not to change the answer is if you see any obvious mistake while reviewing the options कि मैंने last time मैंने accept नहीं पढ़ा था, not नहीं पढ़ा था, ये ऐसा कुछ था तो change कर लो अगर obvious mistake दिख रहा है तो. But if your mind says in the examination hall और इन while giving the GT की नहीं एग्जामिनर ऐसे घुमाना चाह रहा होगा ऐसा करना चाह रहा होगा वैसा करना चाह रहा होगा ऐसा थॉट आ रहा है ना don't change the answer cut your finger but don't change your answer. So over to you sir.
Very aptly said by Dr. Priyansh sir. Sir has given that 12 plus 5 plus 2 rule. So for those who are just joining in, please go back to this video again, save it, listen to it, aram se, make some points and see what are the points which are relevant to you. Many of you, if you already feel that your revision is going fine and your scores are rising, zaruri nahi hai. We are here to just give our perspectives on the suggestions if you might need. So it's not necessary कि आपने सारा कुछ मैं जो कह रहे हैं या सर जो कह रहे हैं वो आपने include करना है. But if you find that is useful for you, that you can incorporate. One thing I would like to add is the distractions. Last 80 days, 70 days में you will have a lot of distractions. Some random person will be coming and saying ये magic program कर लो. How to do medicine in 3 days, how to do surgery in 2 days. You cannot do medicine in 3 days, you cannot do surgery in 2 days. Itna आसान होता, everybody would have passed. So you need to understand that the traditional way of reading your notes, revising them again and again, and then summarizing them together, compiling them together is the most important thing. And one more thing I want to add, in case you feel that you are losing out on something, again, if you are continuing with the preparation, you're most welcome to do it. But in case you feel that you need a bit of help, that some of the students actually asked us, Ki, sir, can we do something about it? So we have a few things. I will not take much of your time, but I will just like to show you one thing here. Rakesh, can you just share the screen? Please share my screen, Rakesh. If the screen is visible.
In the meantime, yeah, I think.
Yeah, so at DocTutorials, we have a 2025 revision booster plan. We have a high impact training where we are doing live interactive sessions based on hard copy workbook. These sessions are framed in a way that they cover all 19 subjects starting from May 18 to June 7. For a change, this time I'm not the opening batsman. We have Dr. Naveen and Dr. Vandana who are the opening batsmen here. I am coming one down and Rajiv sir is two down. So that is how we are taking. And it will be combined with mock test. There will be QRP 5.0, hardly 8 to 10 hours per subject, recorded revision videos along with live workbook based revision, and there will be QBank, bookmark, subject wise test, mini test. So if you are already following something, you are most welcome to continue with it. But in case you feel that there is something lacking in your preparation, or you are preparing at home, or you already joined some coaching and this is your second or third attempt, this is one revision booster plan. We have kept in mind an average or above average student who needs an help in compiling things together and reinforcing it with a live session, a recorded video, QBank, and mock test. All of them combined together, all of them supplementing the same knowledge at one place. And these are the grand test days. The first grand test with video explanation is open for all. Even if you decide not to join, everyone must give it. This is a exam we expect almost more than 50% of the FMG students will be taking. High quality video explanations are there. It will be open from May 11th. So don't miss this exam. And the other exams will be for subscriber base only. And this is the schedule. If you look at the schedule, we have also mentioned what will be the timings. It is a very well thought out plan. We had a lot of faculty discussions done, and how many duration each faculty, each subject will be covering. The printed workbook and soft copy workbook will be provided to you in this. Along with that, you have the 75-day challenge, where in 75 days, we'll make sure that you are able to revise your entire content 2 times, not once, but 2 times. All you need to do is, just hold our hands at DocTutorials that we are going to do. So as I promised, I'll not take more than 1 to 2 minutes. So I go back to Rajiv sir. Rajiv sir, please help out, sir. Yeah. Some students, sir, mera score nahi raha hai. They are like, Rakesh, you can close the screen. Some students say, sir, my score is not rising. And they say कि sir, जो subject मेरा untouched है. There are many students, उनका अभी भी 1 या 2 subject untouched है. Sir, your views on that? Should they consolidate on the existing subject, or should they still touch upon the untouched subject,
sir? Very apt question, first of all. 80 days means you cannot surrender to the subject which you have not yet done. It's not 8 days left or 18 days left. 80 days means there is a scope. As Priyansh has said that everyone has some favorite subject. Everyone has some scary subjects. For scary subject, you must now, for example, I am scared of microbiology. I will do bacteriology from microbiology and antibacterial from pharmacology. Now, after a few days, I will do microbiology minus bacteriology. There will be doable microbiology for me. But leaving microbiology altogether would be costing us a lot of marks. The reason is every subject has got some favorite questions, expected question, commonly repeated topics. We should not really let us lose those marks actually. So 80 days means we should as of now, we should not go very shortcut and really finish the subject, whatever we are doing. Not like that. Please have an organized schedule to follow. And the most important thing, what will happen now, Priyansh sir, Sandeep sir, I think, अगर मैं भी होता तो 80 दिन अभी पड़े हुए हैं. तो पहले तो मैं आपको छोटी एग्जांपल बताता हूँ. मैं गौतम नगर में was taking class sir 10 days before the FMG examination, rapid fire round for ENT revision. Two students met me in the lunch time that Dr. Dhawan, only 9 days left. Now problem is our half of medicine is not done, sir. In surgery, we did not do the general surgery. In pathology, we did not do the systemic pathology. And we are not really comfortable with the short like anesthesia, radiology, psychiatry also. I told them that shortcut, but you can do. Only 9 days were left. I remember that. By the time I ended the day, sir, the notice came from NB. The paper has been postponed by 40 days because MCD election was announced. 40 days, exam pushed to 20th January straight away. So the class was over. I came out and I was roaming around the Gautam Nagar. I saw same two guys from Rajasthan who asked me in the lunch break how to do the subject. They were putting the shoulder bags, full bags in their hand, and they were running towards the road. I said, "Where are you going?" "Sir, we are going home, sir. We'll spend 1 week at home. We'll relax for some time, then come back and study." Now I ask those people that in the afternoon you were desperate to get 4 or 5 days to finish your systemic path or general surgery or short split. Today you are getting a 40 days and you're running away. Like 31 extra days you're getting. Believe me, I forced them. No, don't go to Jaipur. They were going to Jaipur, remember. I made sure that they go back to the hostel room, wherever they're staying, PG. And I said, and they were very kind people. They said, okay, sir, we are not going. And they did not go. And let me tell you, both of them passed the exam also. So the idea is that if you look at this time, that too much time is there, and you start wasting time, then ultimately same days are left again. So as Sandeep sir said, there are a couple of subjects which are weaker. This is the time to execute those subjects. Now, the second important thing which I like to add, Sandeep sir, now how to decide what will I revise from 16 July to 25th July, 9 days. Guys, you have got 2 cycle revision coming. We have prepared one very high impact training for FMG revision, where Sandeep sir is taking pediatric, Priyansh sir is taking biochemistry, Nadeem sir is taking psychiatry, Khalil sir is taking radiology, and Shivani ma'am taking ophthalmology, and everyone is taking specific subjects in a faster way. Now, what happens is when you do the questions, when you do such sessions, you start getting an idea which part of your notes are more important. Please start putting one mark in the center of that page, that this page I must revise 16 July to 25th July. And if some small part of the page is important, just put a star on that. So star pages and star islands. If later on we put a schedule that you have to revise the whole pediatrics in 2.5 hours, you must know which pages are star pages and which island are star islands. You can flip over the pages and you can now quickly, in 2 hours, 30 minutes, you can review the pediatrics completely. Guys, it's all about being systematic. If we waste time, then believe me, nature is very judgmental. I don't know who told us nature is very kind. Nature is really judgmental. Nature really watches us that are we doing hard work or not. If you're thinking I will waste time, my subject which is microbiology is still weaker, it will remain weaker and miracle will happen. I'm sorry that we from the core of our heart, each one of us wants you to pass the exam. That's why we want to tell you very clearly that पढ़ाई मन से नहीं होती, पढ़ाई मन मार के होती है. It's a time for you to be fully dedicated and make sure that you finish 2 secular revision. Please do not run from the questions. Again, I'm saying, and grand tests we are conducting now on our app also, other apps also. Please do 8 GTs as Priyansh said that. Review the GT, learn from mistakes. Dr. Dhawan, how shall I do the MCQs? Every day, do 50 question block, 2 blocks. Minimum use 35-40 minutes to solve the questions. After that, 1 hour, 20 minutes review those questions from your notes. You just do 2 such cycle in a proper way. Believe me, you will be getting confidence and you will get to know what errors you are doing. The most important thing is identify your errors, pattern of your mistakes. And if you do a mistake 2 times, believe me, 3rd time you will not do the mistake in the exam again, because brain would not allow you to fall the same pit 3rd time. So let us solve a lot of questions. Let us do a lot of mistakes in the questions. Let us analyze those mistakes, learn from mistakes. My dear friends, QBanks and GTs are not assessment tools. They are assistive tools. They want you to show which part are important. Number two, how to integrate two subjects. Number three, what are the common pattern of silly mistakes? Number four, which things that we are forgetting? And number five, finishing. Certain new things are added to your knowledge. Over to Sandeep, sir.
Very aptly said, sir. Sir has given some very useful suggestions. Everyone must understand this. And I'll first move to Priyansh, sir. Then I'll add something to what sir said. Priyansh, sir, there are two questions. Similar thing being asked by students. One is, sir, I have been reading the same notes again and again. I'm finding them boring. What different should I do? I know it's a tricky thing. If you could shed some light on this. And secondly, sir, students asking, my GT score is between 130 to 140. So do I still have a chance? And how should I, supplement those things? Over to you, sir. Any of these questions, if you could shed some light.
Yes, so definitely, sir. What I would suggest is कि जब आप same notes को बार बार पढ़ रहे हैं ना, think like an examiner. I will just give you one example. For example, आपके notes में लिखा हुआ है Canon A wave is seen in what? आपके notes में लिखा हुआ है Canon A wave is seen in complete heart block. आप उसी direction में पढ़ते रहते हो, उसको 10 बार पढ़ लिया आपने. If the question will come Canon A wave, your brain synapse will fire and you will get the answer complete heart block. But question reverse direction में भी तो आ सकता है. Complete heart block, what is the finding in GVP? And your brain will not fire at that time because you are reading in just a monotonous way. So while reading, think like an examiner. It may make your speed little slow, maybe 10%, 15% initially, but I'm not saying extensively जाना है, but थोड़ा सा एक टॉपिक जैसे ही खत्म होता है ना, आप थोड़ा सा एक एग्जामिनर की तरह सोचो कि आप एग्जामिनर होते हैं ना, क्या क्वेश्चन बना, मैं ऐसे भी पूछ सकता था, ऐसे भी कर सकता, ऐसे. एंड धीरे धीरे सबकॉन्शियसली आपका वो माइंडसेट बन जाएगा. नोट्स पढ़ते टाइम यू विल स्टार्ट थिंकिंग लाइक एन एग्जामिनर. And once you start thinking like your enemy, because examiner is, let's consider as enemy, आपको उसका mindset पता लग गया ना, तो आपकी उसकी हर चाल पता लग जाएगी. And then the things will be easy for you. This is one thing. Second, don't make huge targets in front of you कि मेरे को आज ये पढ़ना है, कल ये 3 महीने बाद, मतलब 70 days के बाद मैं ये पढ़ रहा हूँ, आज ये पढ़ रहा हूँ. Don't do this. Your brain never accept big task. The brain is always wants to preserve the energy. तो उसको बड़ी चीजें अच्छी नहीं है. वो आपको बहुत सारे शॉर्टकट्स बताएगा, यार ऐसे नहीं हो रहा, ऐसे कर लेते, इससे भी नहीं, इससे भी छोटा रिवीजन आ गया, ये 2 घंटे का आ गया, ये 30 मिनट में करा रहा है, ये तो 10 मिनट में पढ़ा देगा. तो डोंट रन फॉर दोज शॉर्टकट्स. योर ब्रेन विल टेल, दिस इज अ टेम्पटेशन दैट योर ब्रेन विल से कि नहीं उससे हो जाएगा. एंड यू विल ऑल्सो फाइंड 10 गुड थिंग्स अबाउट दैट कि नहीं हाँ उसमें ऐसा भी बोल रहा था, सीनियर भी बोल रहा था, ऐसा है. सो डोंट रन फॉर दैट. एवरी डे मॉर्निंग व्हेन यू गेट अप, you have a very simple thing कि मेरा दिन जो है ना 5 पार्ट में मैं डिवाइड करूंगा. I will read subject 1 main. I always say to read 2 subjects in a day, 1 bigger subject, 1 medium or small subjects. So total study hours का जो भी टाइम है आपका, जितने में आप नोट्स पढ़ने वाले हैं, तो उसमें से मेजर पार्ट आपका फर्स्ट सब्जेक्ट को चला गया, थोड़ा पार्ट सब्जेक्ट 2 को चला गया. एंड एवरी डे 2 slots of 50 MCQs. That is the third part. Fourth part, जो सब्जेक्ट हमारे हो चुके हैं, हम आगे आगे तो चलते जाते हैं, बट जो पीछे हो गया है उसको भी वापस लेना है साथ में. तो एवरी डे ट्राई टू स्पेयर मे बी 45-50 मिनट्स फॉर द सब्जेक्ट्स व्हिच यू हैव ऑलरेडी कंप्लीटेड इन द रिवीजन साइकिल. जस्ट जैसे फ्लिप कर लो कुछ पेज, कभी कुछ फार्मा खोल लिया, कभी कुछ जो हो गया उसको. एंड द लास्ट थिंग, as we have discussed, every day the 30 minutes or 40 minutes for those 2 subjects जो हमें नहीं आते. बस हमारे को रोज सुबह उठ के खाली कितने पेज होंगे ना, वो मैटर नहीं करता भाई. कि मेरे को देखो, हम कितनी भी कोशिश कर लेना, 25th of July को कुछ ना कुछ बाकी रह जाएगा. चाहे जिसके 240 भी आएंगे ना, उसको भी लगेगा यार मेरे को 2 दिन और मिलते मैं ये पढ़ लेता. तो डोंट वरी कि मेरा कितना खत्म होगा, व्हाट विल बी लेफ्ट. व्हाट इज मोर इंपॉर्टेंट कि जो हम पढ़ रहे हैं, वेदर आई विल बी एबल टू रिकॉल दैट, आई विल बी एबल टू इम्प्लीमेंट द थिंग्स इन द एग्जामिनेशन हॉल फ्रॉम दैट और नॉट. अगर हमने उतना ही कर लिया ना, हम पास हो जाएंगे. तो कितना रहेगा उसकी चिंता ही मत करो. वो चिंता ही हमें एक्चुअल में मार देती है, हमारा मोटिवेशन ही खत्म कर देगी. मेरा तो होने ही नहीं वाला, मेरा वो नहीं होने वाला. अरे भाई जो हो जाएगा वही याद आ जाएगा ना, तो भी बहुत है. So trust yourself, back yourself, and don't worry. We all are always there for to help you, to guide you. As sir said, the program that is happening. अगर आपको लग रहा है ना यार मेरे 4 सब्जेक्ट वीक है, तो you see those 4 because these are going to be where I will be taking the biochem 5 hours, just biochem and it will be done from cover to cover. I will try to take care of each and everything that can be asked. The same pediatrics, the ones, everyone, they have made the material in such a way, the workbook is so nicely designed that is going to cover each and everything. तो अगर आपके कोई 2 4 5 सब्जेक्ट जो वीक है, you can cover from there. Don't worry about that. And sir rightly said कि कोई भी सब्जेक्ट में complete blank नहीं जाना है. It's going to be is a disaster for us, right? So you can do from there. अगर हमको लग रहा है कि यार मेरे से होने ही नहीं वाला ये सब्जेक्ट, so let's do it from there, from this program that is happening, right? Over to you, sir.
Thank you, sir. Very nice suggestions given by Priyansh, sir. I'll summarize what Priyansh sir said and Rajiv sir said in my own way. I'm a movie fan. So, pehla Hindi movie dialogue. Ye Jawani Hai Diwani. Bunny is, thinking about covering all these places, and then he's, feeling anxious कि I will miss out on watching a few things. So, what does the heroine say to the hero? कुछ भी करो बन्नी, कुछ ना कुछ तो छूटेगा. जो है देख रहे हैं उसका मजा लेते हैं. This is what Priyansh sir said. Whatever you are reading, something will always be left behind. Even for the best person, even for somebody getting 240, 250, उसके लिए भी something will be left behind. Whatever you are reading, just imagine in your mind that this is going to be asked. Am I reading it properly enough that I will be able to recall out of those 4 options? That is one thing. And as Rajiv sir said, time is always available. If you have more time, you waste more time. So I'll move over to an English movie, a slightly older Hollywood movie, where they talk about Parkinson's law. It's not Parkinson disease, Parkinson law. Parkinson law says time dilates and time constricts. What it means is, if you have 10 hours available and only 2 hours of work to do, we have a human tendency to spread that 2-hour work over 10 hours. हम 2 घंटे का काम 2 घंटे में नहीं करते, हम 2 घंटे का काम 10 घंटे में स्ट्रेच कर देते हैं. But at the same time, if we condition our mind and we are focused enough and we have only 2 hours, we can compress that 10-hour work into those 2-hour period. So it is all in the mind. It all depends upon how focused you are. And I will add again here, in case your 3, 4 subjects or 5 subjects, you feel कि नहीं हो पा रहा, I'm always on the verge of giving up, you can join this HIT program, this last minute revision program we have devised at DocTutorial. For example, pediatrics नहीं हो पा रहा, 5 hours of pediatrics I will be taking live. 20 topics taken from what I feel have a high likelihood of being asked. I will discuss in 5-hour session with 1 15-minute break. You will get hard copy note. फिर उसके बाद there is 10 hour of QRP program available. All the topics apart from what I taught, you can go through those 10 hours of videos. And trust me, they are, quick revision program kind of a thing. In one day, your entire pediatrics is done. Solve the pediatric mock test after that. And if you want to, go through the grand test questions, again, you have video explanations coming in some of the grand tests. So your pediatrics from, not being in the fighting chance, you now have a very strong fighting chance. You can do it for every subject that you have available. So even if you feel कि आपका 18 subject हो गया है, one major subject is missing, for example, you can still consider this program and use it selectively for your advantage. Over to you, Rajiv sir. Rajiv sir, what other things a student should watch out at this moment, sir?
So one thing I would like to say for the people who have appeared in last 1 exam, 2 exam, 3 exam, and they're repeating, sir. So people who have been not able to clear last, 3, 4 exams, them. My dear friends, either your notes are old notes or they are not sufficient notes. You have taken some shortcuts for some subject which were very important subjects, but it's human habit that we keep on doing the same thing. हमें पता है कि ये गलत है, पर हम करते चले जाते हैं क्योंकि नया करने में बहुत एफर्ट लगेगा. लेकिन जब तक हमारी गायनी वीक रहेगी, गाइस आप चाहे जितना मर्जी बोल लीजिए, ऑब्स गायनी, सर्जरी, फार्मा, पैथो, पीएसएम, ये 5 वो सब्जेक्ट होते हैं जिनमें लगभग 100 क्वेश्चन का मामला बन जाता है इफ यू हैव रेड प्रॉपर्ली. और अगर हमने इन्हीं क्वेश्चन में कुछ पार्ट्स छोड़ रखे हैं और लास्ट 2-3 बार में हमारा एग्जाम नहीं हुआ है, I think it's a reminder for all of us that let us look beyond our conventional resources we are using. For example, your pediatrics is not strong, you think so. Sandeep sir is saying that you attend the HIT revision program, high impact training program for the subject, which is faculty live online live workbook based program. And the QRP, if you do in 8-9 hours, I think you can make your pediatrics way stronger. And if last time you review the paper, pediatrics was substantially high last time. So we can bridge the gap. The people from 139 to 149, believe me, you are very close to passing the paper. And we really want each one of you to get out of this whole thing. We do understand it is very painful to start again and again. But my dear friends, let us take the responsibility on ourselves also, that are we ready to look beyond our usual resources? Are we ready to look beyond our 3 session old notes? Or are we still wishing to continue only with those summarized notes only? We have to look beyond the current content we have. Number one. Number two, sir, my request to each one of you is, please do not change your GPS location. Wherever you are, stay put there. Because if you change the location from X to home, it might take a lot of time for you to adjust again. Until unless there are 2 reasons. Number one, financial reasons. You are not able to really be there. Number two, your family reason. Maybe somebody is unwell, you have to be there. Otherwise, if everything is sorted, जहां पे हो वहीं पे ही 80 days और मेहनत कर लो. ये एग्जाम पास किया जा सकता है 150 out of 300 विदाउट नेगेटिव मार्किंग. प्रियांश सर ने भी क्या बोला और संदीप सर ने क्या बोला, ये वो मेडिसिन, वो महामाया है जिसको पूरा ना जान पाए. आप पूरा सीएनएस तो कोई भी नहीं जान सकता, चलो मान लिया. पार्किंसोनिज्म, एपिलेप्सी, इस बार गुलियन बारिश पढ़ के ना जाना, तुम्हें लगता है कि थोड़ा सा गलत मामला है? जीबीएस आने के चांस तो है ही है ना. माइसिनिया ग्रेविस है या कुछ भी चीज है, फॉर एग्जांपल एसएलई है, कुछ भी है, कहीं ना कहीं हमारी कमियां रह जाती हैं और वो टाइम मिला हुआ है. अगर वो ठीक करेंगे तो ही जीटी का स्कोर इंप्रूव होगा. ग्रैंड टेस्ट का जब इवैल्यूएशन करते हैं हमें दिखता है कि मेरी फार्मा अभी भी वीक है, मेरी माइक्रो में अभी भी वो दम नहीं आया है, मेरा अभी भी लगता है एनाटॉमी में पूरी तरह कंट्रोल नहीं आ रहा, सब्जेक्ट मॉडरेट रह रहा है. और कुछ सब्जेक्ट मैंने पढ़े ही नहीं है, हर बार मैं ऐसे दे देता हूँ, देखते हैं क्या होता है. डर्मेटोलॉजी, ऑर्थोपेडिक्स में देख लेता हूँ, कर लेता हूँ. आई थिंक जीटी का जो रिव्यू आता है वो रिमाइंडर है कौन से मेरे सब्जेक्ट बहुत वीक है. जब तक उनको हैंड ऑन एड्रेस नहीं करेंगे तो कोई मैजिक तो नहीं होगा ना. सो गाइस प्लीज अंडरस्टैंड, सबसे पहले अपने आप को क्रिटिकली इवैल्यूएट करना सीखो और अपनी जहां भी कमी पेशियां हैं, wherever you are having lacuna, please do everything to fill that lacuna to the extent possible. 100% कोई नहीं कर पाया. संदीप सर ने बड़ी अच्छी लाइन बोली, मुझे बहुत अच्छी लगती है कि जैसे मैं भी कहीं घूमने जाता हूँ, मेरे से पूरा नहीं देखा जाता, कुछ भी कर लो, बहुत कुछ छूट जाता है मेरा. तो कोई बात नहीं, जहां बैठ गए मतलब मजा आता है. सर ने भी ये बोला है कि या तो हम ऐसे ही पूरा करना है, हम या सब्जेक्ट बिल्कुल शॉर्टकट से 20 पेज में करवा दे. ये दोनों एक्सट्रीम खराब हो जाती है. उससे क्या होता है कि हमारा कुछ सब्जेक्ट बिल्कुल कंट्रोल नहीं आता. लेट अस डू द राइट थिंग. नंबर वन थिंग आई वुड लाइक टू से, प्लीज बी डिवोटेड. 80 days लगा लो. एफएमजी एग्जाम में एफ क्या है? फाइनेंशियल इंडिपेंडेंस है. ये फाइनेंशियल इंडिपेंडेंस का पहला कदम होगा तुम्हारा. इसको लेने के लिए बहुत रातें जागनी पड़ेंगी, नींद छोड़नी पड़ेगी, सुस्ती त्यागनी पड़ेगी. और ये जो नेगेटिविटी का हमने वो अपने अराउंड बना रखा है ना कि पता नहीं क्या होगा, भाई पता नहीं क्या होगा, करेंगे तो होगा, करना तो पड़ेगा ना. तो इसलिए लेट अस डू इट फुली और अपनी कमियों पे काम करते हैं. मैं सही बता रहा हूं तुम्हें, हर रोज अपने डर कम होते जाएंगे तो हमारे मार्क्स बढ़ते जाएंगे. संदीप सर.
Very aptly summarized by Rajiv sir. Rajiv sir is, देखो काफी लोग अभी ज्वाइन कर रहे हैं. Some of the queries you are asking in the comment box, sir and Rajiv sir and Priyansh sir have already covered them. So my request to you कि आप उसको दोबारा सुने. After the immediately it will go up on the YouTube channel and just listen to them again. Many of the queries have already been answered. So, Dr. Priyansh sir, please tell about again a couple of things before Khalil sir joins in. Khalil sir is joining us just now in 2 minutes. So, Priyansh sir, if you could shed some light कि sir previous year question को क्या मुझे सारे करके जाने हैं and previous year topic क्यों करूं मैं? Like what is the rationale of doing previous year topic? Like some students were of the opinion कि इस बार PYQ बहुत कम आए, तो we should do more of fresh questions and fresh kind of things. ये हमेशा से वो रहता है कि सर PYQ आएगा नहीं आएगा. तो सर what is your view on this? How should someone tackle these PYTs and PYQs, sir?
सर जैसे हमारे डिजीज में 2 तरीके के फैक्टर्स होते हैं, रिस्क फैक्टर, मॉडिफाइबल, नॉन मॉडिफाइबल. तो एज ए क्लिनिशियन हमें नॉन मॉडिफाइबल चीज़ों पे ज़्यादा सोचना नहीं होता है. तो ऐसे एग्जाम में भी है ना सर, चीजें तो नॉन मॉडिफाइबल, देर आर सर्टन थिंग्स विच वी कांट कंट्रोल, दैट how many new topics will come, how many repeated things will be coming. So what we think is, what we should do is ki what is modifiable is our knowledge. Let's make it strong. I am not a very keen person to go for only pyts or only pyqs, so I always very keen to go for the notes. That is, for me, is the best. You go for the notes, you revise that. But if you can't do that, there will be certain areas which you are not able to do that. Just see what is important, highlight them, do it. For very big subjects, as someone is asking what to do with the bigger subjects, if you find that the many of us says that कि मैंने ऐसा भी सुना है कि भाई ऐसा बोलते हैं, सर पैथो पढ़ लेते हैं, फार्मा पढ़ लेते हैं, फिजियो पढ़ लेते हैं, और इससे काफी कुछ मेडिसिन हो जाएगा. बट इसको रिवर्स डायरेक्शन में भी देखना होगा आपको. अगर आप मेडिसिन पढ़ोगे ना, तो बहुत सारी उधर की चीजें भी हो जाती है. सो इट्स नॉट ओनली दिस वे. So I would never say कि you skip this subject. And if you see the last paper, हर क्वेश्चन ऐसा लग रहा था कि मेडिसिन से आ रहा हो, a patient coming with this so and so. So that mindset we have to create, and that comes from medicine part. So don't skip that. Try to do some part of that. And if something is very difficult for you, just see what is important and do it from there. So welcome, sir. Sir Khalil sir, over to you, sir.
Good evening. Yeah, I think I've just joined in the middle. I think the students have got a good time this time, right? So 2 months extra mila hai, to uska best use agar karenge, I think there'll definitely be good results and enough time. I would say with the most of the students were preparing for June only, and with a 1 month of extension, there is a one good round of revision that can happen. So high chances of clearing the exam if they consistently put in efforts. और एक चीज रहेगा कि स्टूडेंट्स के अंदर ये माइंडसेट होता है कि जून का एग्जाम डिफिकल्ट होगा, दिसंबर का एग्जाम डिफिकल्ट होगा. अगर हम जाके पीवाईक्यूज देखते हैं, all the papers have the similar standard. It is never that June exam is more difficult or December exam. ये बना लेते हैं हम लोग, imaginary students will make these kind of things. When you look at the PYQs, you will understand yourself whether the exam was actually difficult or was tested on the same topics. So, and the kind of audience who are writing the exam is also different. जो students June का exam लिखते हैं, तो थोड़ा सा आप ऐसा bias आता है. So I personally don't want the good students who are studying or putting efforts and all to be worried about these kind of things, and put in full heart and effort. And definitely, okay, everybody has cleared the exam. We have seen so many batches, every batch has cleared the exam. Sooner or later, everybody will clear. So too much of unnecessary pressure, unnecessary imaginary fear is not needed, and it's a doable exam, right? And I think with this extension, I think students should give in their 100% for this remaining days of their exam. Yes, sir.
Sir, because you have joined late, now you'll have to answer more questions before we
Sure,
move to other.
sure.
Sir, you are the human intelligence that we have. At DocTutorials, we don't have artificial intelligence. We do have in our app, but we rely more on human intelligence. So it is our mentors, it is our faculty who come up with all these programs, like the HIT program we told you about. And none better than Khalil sir to answer, because I was thinking of putting this question to Rajiv sir and Priyansh sir. But now that sir is here, sir, number one, how to tackle these 4 or 5 short subjects, and how to tackle radiology, sir. Someone who is almost on the verge and somebody who was thinking of leaving them. Rajiv sir has already convinced them that you have to read them. How to read them, sir?
Okay. सर, शॉर्ट सब्जेक्ट्स आर स्कोरिंग, और शॉर्ट सब्जेक्ट्स में अगर हम कोई भी सब्जेक्ट का शॉर्ट सब्जेक्ट देखते हैं, दे आर वेरी वेरी स्टैंडर्ड क्वेश्चन दैट आर आस्क्ड, वेदर इट इज डर्मा, वेदर इट इज रेडियो. Very few questions will be out of the box. But if you're a student who is looking to passing this exam, very bare minimum preparation for these short subjects will give you high score rate. छोड़ के जाना is not an option. You have to put in effort. Notes देख लो एक बार. अगर आप एक बार flip through भी करोगे notes pages के, right, you will have enough confidence. और आप you finish the notes once and go back and doing the PYQs. The HIT program that you are telling, sir, it's actually a very concise version of the revision of these short subjects. I would say HIT करो और जाके आप PYQs कर लो. You are done 70 to 80%. If you don't want to miss any question, yes, you will have to go for the regular class and stuff. But आप लोग का licensing exam है, आपको अगर hit करके अगर आप PYQs कर लोगे, I think you have high chances of doing these subjects if you have not studied. If you have put in effort in your subjects, जो सब्जेक्ट आप ऑलरेडी क्लास अटेंड करे हो, वीडियो देख चुके हो, राइट, you're thorough with that subject, I think sticking to your main notes is important. वो notes revise हो जाते हैं. जो initial took 4 days will take 2 days, will take 1 day. That transition will happen. That natural transition will happen when you keep revising the same notes. If you have not studied any subject, please stick to hit completely and do the PYQs and build the subject from there. Ho jayega. And coming to radiology, for the students who have not done, I would say I have made a very crisp quick revision program also, and the hit program, maybe we are trying to cover the entire thing that we have done in the QRP sessions in a very fast track manner, and can solve the PYQs of NEET PG and FMG. That should give you a base minimum preparation. For all the other students who have already done and who are looking at good scores and stuff, sticking to your main notes of difficult questions, be clinical concepts भी अच्छे से cover कर सकते हैं, especially related to medicine, surgery, OBG, orthopedics. A lot of integration will be happening, and the question जो question standard आता है, जो difficult questions आते हैं, अगर आप वो कर लेंगे, if you have already invested time and energy into that, you will always have that cushion with your clinical subjects if you're getting some rare questions also in that. So I think radiology is a scoring subject. As far as my experience with FMG is there, 17 questions, 15 to 17 questions from the notes of radiology will come. So leaving a integrated subject like radiology is like missing out the essence of all the other subjects also. So it will help if you can do that thing.
Very nicely said, sir. Over to Rajiv sir. Rajiv sir, मैं student हूँ. I get stuck up in two options. How to tackle it? Related question. I end up in the two options. I know the answer is among these two options. First, I mark the correct answer. Then I change my answer. What to do about it?
सर आप चाहे 10 साल पढ़ लो, लेकिन लगभग 120-130 क्वेश्चन में आपको दो चॉइस में कंफ्यूजन होना ही होना. अगर मेरे सामने पेशेंट बैठा होगा, मेरे दिमाग में कभी भी एक डायग्नोसिस नहीं आता. There is always one more diagnosis in mind. But we always go for the most probable diagnosis. So most of students feel that मुझे सटीक आंसर पता होगा तो मेरा पेपर अच्छा जा रहा है. ऐसा नहीं होता. It's not physics, chemistry, biology. Bryophyte, teridophyte, gymnosperm, angiosperm. These are human beings with a combination of symptoms, and there are overlapping symptoms between two diseases. So you are bound to get confused between two choices, but don't start as like evaluating yourself कि मुझे जीटी में तुक्के लग रहे हैं, मेरे तुक्के लग रहे हैं. ये भी प्रॉब्लम आ रही स्टूडेंट को. नंबर आ जाते हैं तो भी प्रॉब्लम है. नंबर आते ही लगता है कि नहीं मेरे से गेस्ट वर्क हो रहा है. Number one, please understand, a doctor cannot diagnose and manage all cases presented to him or her. Therefore, a student cannot solve all the MCQs presented to him or her. Around 50 to 60 questions are unknown for every topper also. Don't worry about that. Number one. Number two, confusing between two choices does not mean that you are going wrong. It means you are being analyzed on the scale that are you able to make differential diagnosis or not. Sometimes you go right, sometimes you go wrong. For the good people who learn from the mistakes. No. This was this because of this was the given over there. And they mark that point in their notes. Next time, if this is the ECG finding given, I will mark this particular block over there. That's how we do that. Changing choices is the fashion nowadays. Why? Because, like 2 blocks are difficult. Remaining 4, you do rapid fire round. Fastest finger first. Now, the last 10-15 minutes which are left are actually that create the problem. Priyansh has said very golden thing. Please note that. What did he say? Only change the answer of those questions in which you missed a critical word like not true, all are true except. Otherwise, don't start evaluating the question one more time. The basic problem is whenever we have changed the answers, please write in the chat box how many times you feel that, how many of you really agree with me? Whenever you change the answer, 80% time you feel पहले ठीक लगाया था, फिर बाद में गलत कर दिया. You know why? First you were MBBS doctor, and then suddenly you became neurosurgeon, neurologist, rheumatologist, neonatologist, and then you come with a very fancy answer over there. Then you regret, my God, what did I do? Let me tell you my understanding of last 26 FMG exams. Common things are asked commonly. Common things are asked commonly. Rare things are rarely. Common things are asked commonly. Rare things are asked rarely. Whenever you change the answer after overthinking, most of the times you mark common thing as rare and you lose the marks there. Please understand that. Hold the temptation. Hold the temptation. I know, because you're not convinced sarcoidosis because you want to present something very fancy over there, because you want to prove to examiner that I know that rare disorder also. The poor examiner only wants to solve sarcoidosis only. Don't worry about it. So the take-home message is: do questions, learn from mistakes, do GTs, analyze GTs, and mark what are the pattern of mistakes we have. and learn from that mistake. Believe me, third time you cannot do the same mistake over there.
Sir, very useful
Sandeep sir.
suggestions. Very rightly said by sir. I always say in my class also, if you have not heard about a syndrome, that is not the answer. If you have heard about a syndrome and you have to take a blind guess, the more likely syndromes like Down syndrome, Edward syndrome, these are going to be your likely answers. Don't think of Otahara syndrome or some, random Osler-Randu-Weber disease. They are not likely to be the answers in your question. So the more likely answer is always the correct answer. Very rightly said by sir. Priyansh sir, sir, two questions again आपके लिए. Two questions I'm asking you. One, biochemistry भूल जाता है. How to go about biochemistry, sir? One question. Second, sir, score stuck between 145 to 149 since last 2 or 3 attempts. Any specific suggestions for me? Both questions to you, sir, and to other faculty also.
सर बायोकेम तो सब्जेक्ट बना ही भूलने के लिए सर. तो अगर आप भूल जाते हो तो यू आर ए नॉर्मल ह्यूमन इंडिविजुअल, सो इट्स नथिंग टू वरी अबाउट दैट प्रोसेस. आप उसको बस एक ही तरीका है यार, बार बार पढ़ो, और कोई भी साइकिल आप रटने की कोशिश मत करो. हर साइकिल में देयर इज अ फिक्स सेट ऑफ क्वेश्चन दैट दे आस्क एंड व्हिच वी डिस्कस आफ्टर एवरी साइकिल. आई टोल्ड यू दैट कि यार इस साइकिल में ना ये 5 पॉइंट बहुत इंपॉर्टेंट है. आई नेवर से टू यू टू रिमेंबर द साइकिल. द मेन डिफिकल्ट पार्ट इन बायोकेम इज द साइकिल्स. एंड द गुड थिंग इज दे इट्स नॉट अ थ्योरेटिकल एग्जाम कि आपको कोई बोलेगा कि क्रैब साइकिल लिखो या ग्लाइकोलाइसिस लिखो. यू डोंट हैव राइट. सो देयर इज अ सर्टेन सेट ऑफ क्वेश्चन दैट दे आस्क and this is what you need to remember. So when you are reading or revising the biochem, don't focus on cycle. उसको 50 बार लिख लिख के रटने की कोई जरूरत नहीं है हमारे को. उसमें से पूछने क्या वाला है वो पढ़ो और उसको याद करो. So that way your biochem will reduce to 60% and then the things will be easy for you. Now coming to the second question, sir, as you said 149 145, the idea is पहले हमें को एक्सेप्ट करना होगा यार, हमने कुछ ना कुछ पिछली बार गलती की है. इफ यू डोंट एक्सेप्ट दैट देन वी विल नॉट बी एबल टू रेक्टिफाई दैट कि यार मैं तो 147 ला ही रहा हूँ. नाउ इट्स नॉट दैट यू जस्ट हैव टू गेट एडिशनल 3 or 5 marks, right? We are starting from zero again. Consider yourself as a fresher and then the things will start falling into place. देखो आई अंडरस्टैंड अगेन कि यार इतना आसान नहीं है कि खाली सोच लेना कि हाँ मैं फ्रेशर हूँ मैं वापस पढ़ रहा हूँ. इतना भी आसान नहीं है. हमारे दिमाग में 10 चीजें चलेगी, 50 चीजें बार बार ख्याल भी आएगा, लेकिन कहीं ना कहीं हमारे को एक चीज लेके चलनी है यार, मेरे को पास होना है एक ही बार में. नाउ दिस गुड 80 days विल चेंज द एंटायर गेम. सो लेट्स आप एक ही टारगेट लेके चलोगे यार, मेरे को 80 दिन के बाद ऑन द 80th day आई शुड नॉट हैव अ रिग्रेट कि मैं इससे बेटर कर सकता था. अगर आपको ये फीलिंग आ गई ना कि मैंने मेरे 80 दिन अच्छे से निकाले, 100% you are going to clear the exam. So every day just make it count, not make a big plan. Just those anyone who is 145 147 or fresher or anyone, let's make every day count one by one. कितना होगा कितना रह जाएगा doesn't matter, लेकिन ये 80 दिन मैंने मेरा बेस्ट दिया एंड आराम से हो जाएगा आपका. Because last 3-4 months you are doing so many hard work, yeah? Sleepless nights, class ke baad reading the notes, revising the notes, so the things are there. You need to back yourself, but it's just a matter of 2.5 months and the things will be done.
So very practical suggestions given.
So I would
sir. Yes sir, please sir.
Yeah. So I just want to tell the student, look at the screen right now in front of you. We have people like Khalil sir who is actually knowing this thing in and out for last so many years. Is running such a beautiful place in a rise. We are getting in touch with so many students. Actually, these all learnings are coming from lot of previous interaction with lot of students. Priyansh is sharing, or Sandeep sir is sharing. All these things are actually having one intention, that you guys can make it, and we want to put our 1 cent into your success. But please remember, the 99 cents for you guys, and it's your own hard work over there. We are blessed to have a Nadeem sir was supposed to join today, but he's traveling. Shivani ma'am is there, Vandana ma'am is there, Raja Menon sir is there, Rahul Rajiv sir is there, and lot of people. I'm sorry, not all the names over here. Everyone is so much into it. The reason is that we really know that you guys can do it. Trust me on this. Last time you did not do it, we know that there was some lacuna, and all these programs like like HIT or the quick revision program. If you see radiology, I was just seeing, I was free on the airport. Sir has done such a phenomenal job in radiology quick revision program. By chance, you could not do radiology till now, and you're not satisfied with your, own, notes. Why not really see the quick revision program and bridge the gap over there? There's 149, 139, 141. The gap is very small. Reduce the silly mistakes, number one. Number two, don't have the temptation to change the answer. Number three, fill up the lacunae. And we are here to help you out over there. If you look at the reviews of the grand test of doctorals from the previous students from the previous sessions, a lot of students, they first of all they'll say, so we found it challenging. But after the real exam is conducted, they will tell us that this exam was almost close to what the real exam was. So we have the resources available around us. Only thing is we have to look beyond what we have currently, and we have to utilize those things available out over there. So please make sure that you put your level best, and we are here to help you out. We really want you to succeed the examination. Sandeep sir.
Very nice suggestions given by Rajiv sir. So Khalil sir, one question is being asked by multiple students in the chat box. You might have also seen. Should I do PYQs of NEET PG and INICET also? Are they mandatory, or should I stick to FMG PYQs? Sir, you are mute, sir. Khalil sir, you're mute, sir.
Yeah, sir. I think it is a good time to do NEET PG questions and also INICET questions. But when you're solving NEET PG, you have to do it thoroughly. But when you're trying to solve INICET questions, don't go into details of rare topics, rare questions, or a different mode of this. But jo topic aapko padhaya gaya, but if the presentation of the question is different, that learning will always help you. And there are a lot of questions that can be easily absorbed when you're trying to solve. So don't go into a research mode with INICET questions. Try to do it superficially, and jahan pe aapko topic pata hai, wahan pe jahan galti gayi hai, you can slow down there, understand ke kahan pe aapne apply nahi kiya, but don't try to go into depth of the rarer topics that have been asked. That is not the kind of exam that you're going to face into. So NEET PG, yes, you have to do. A lot of questions are the similar mode that we have today. Actually, NEET PG FMG, the exam pattern is almost the same. So NEET PG to karna hai, it will help you advance. INICET ko liye bahut hi logically aapko approach karna hai. Please always try to see that you skim through the paper, and only the relevant topics that are you able to catch it or not, that you have to be testing, rather than trying to go into unnecessary details. And one student was, the one thing is about students in between 145 to 149. First, I would say is, you be sticking to your main notes completely. You are already done so well. I know this must be a revision of your entire preparation of last time. And if you have balanced out on the subjects that you have not done last time, you deep inside, what you have improved from the last preparation to this time. Have your subjects that you have not done well, have that been completed? If that is not completed, we still have this whole month. I would say, we have 1.5 months after from June 1st also. That's like July 26th is the exam. So you have enough time to balance. So anybody who have not done subjects, please take out this month to fill up those subjects, right, properly, not just superficially. Try to complete those subjects. And accuracy badana hai. 149 students who get into 145 to 149 is just about accuracy. They know the subject. It's all about increasing the number of question practice and improving their accuracy, so that small numbers that they are missing out are reduced. Yes, sir. Sir, mute pe, sir.
Okay, sir. Sorry. So one student is asking how many hours per day I should read. See, it varies from people to people. It's like asking how many chapatis should I eat in a day. Some people, they are okay with 2 chapatis in one meal. Some people need 8 to 10 chapatis. And some people are okay with 5 to 6 chapatis. So there is a maximum and minimum you need to define. The minimum is, if you're not attending a coaching right now and you're preparing and sitting at home and preparing, anything less than 7 hours per day, that is not sufficient. You need to increase. Anything more than 14 to 15 hours in a day, it is not sustainable, because you need some rest, you need some mental space, and you need to conserve some energy for the last 25-30 days also, where you can go up to 14-15 hours. So if you are able to take out consistently, it's not like you're reading 18 hours one day and then sleeping for the next 2 days. If you are able to take out about, say, 9 to 10 hours total time, out of which about 70% time is taken towards theory and 30% towards practice of questions, I think you are doing fine. But anything less than 7 hour, more than 14 hour at this moment should be avoided. Again, it will be very personal, but generally you need to have that much of dedicated time available. Average about 8 to 10 hours is what most people are able to take out. And if you are able to take out consistently, you should do great. Secondly, sir, one more question, Rajiv sir, कि एंजाइटी कम कैसे करें एंड क्या मैं पहले नोट, ये सर आप पहले भी आंसर कर चुके हैं. सेकंड थिंग दे आर आस्किंग इज मेरा पहला नोट खत्म करूं या जो सब्जेक्ट पढ़ा है उसी को रिवाइज करूं. आई थिंक मेनी स्टूडेंट्स हैव जॉइंड नाउ, सो दे आर आस्किंग इट अगेन. सर ब्रीफली इफ यू कुड समराइज इट अगेन.
सर एंजाइटी खत्म नहीं करनी होती, एंजाइटी मैनेज करनी होती है. एंजाइटी खत्म होती नहीं है कभी भी. है डॉक्टर खलील, डू यू हैव एनी एंजाइटी राइट नाउ सर? प्लीज क्विक ऑनेस्ट आंसर सर. So you're mute, sir. Sir has muted himself. So you're mute, sir.
I am not comfortable at all. Look at the screen presence and all. Already it's like a lot of anxiety is already going on. So anxiety, as you said, is always there.
So please learn. Sir has a very honestly said that. See, anxiety is, you know what, the word is itself having anxiety actually. This word is not good. It's a concern. It's a concern for our future, for our well-being. And human mind always think both ways. I always say, a lot of people say to me also, used to say, be positive. Be positive कुछ नहीं होता. Positive blood group होता है बेटा. Try to remain positive as much as possible. पूरे दिन में डॉक्टर खलील को भी, डॉक्टर संदीप शर्मा को भी, मैं तो बहुत बात करता रहता हूँ इन लोगों से भी, मुझे भी. हर नॉर्मल इंसान को 80% अच्छे थॉट आते हैं, 20% नेगेटिव. डर भी लगता है कि यार ये ना हो जाए, हम ये करने वाले हैं. अभी हमने एक प्रोग्राम किया था नीट पीजी के लिए, बहुत ही सीपीआर प्रोग्राम था, नाम ही सीपीआर था उसका. डर डर के शुरू कर रहे थे कि देखते क्या होता है. It has become a grand success over there. Like that was for NEET PG people. तो डर तो लगता ही है. That anxiety. अब खलील सर का initiative भी था उसमें काफी. So I can understand, you know, today we are getting the reviews की वो अच्छा.
I think there is a lag at Rajiv sir's end. Khalil sir, if you could continue. Oh, sorry, back. Sorry, sir, there was your screen got stuck.
Yeah.
Please continue, sir. Last 10 seconds.
लास्ट पार्ट में ही बोला था. एंजाइटी कम करने के जीरो नहीं हो सकती. कम करने के दो तरीके. द बिगेस्ट एंटीडोट टू एंजाइटी इज मोर हार्ड वर्क. द डे यू स्टार्ट कंप्लीटिंग योर शेड्यूल एंड यू just fulfill the timetable commitments for 5 days, you feel less anxious. Number 2, second antidote, which works in my case also, is that whenever anxiety really bothers me, I just have prayer in my heart that I'm doing my level best. I leave the rest to God to decide. Jo hoga dekhi jayega. That attitude actually pays in the exam also, in the life also. I can tell you that. So number 1, more hard work. Just whatever commitment you make to yourself for the schedule, follow that. सेकेंडली, प्रेयर तो बहुत ही बढ़िया बात होती है. मैं भी पास हो जाऊं, मेरे फ्रेंड भी पास हो जाए. मे आई पास, माय फ्रेंड्स आल्सो पास. थोड़ा सा ना इजी रहना बढ़िया रहता है. ज्यादा मतलब वो भी नहीं कि करके दिखाएंगे, तोड़ देंगे, फोड़ देंगे, पास होके दिखाएंगे. मुझे उस तरह भी समझ नहीं आता, टू बी वेरी ऑनेस्ट. हम मेहनत करेंगे, बाकी ऊपर वाला जाने का काम है, पर मेहनत कर रहे हैं. पहली बात, मतलब मैं सबसे पूछना चाहता हूँ, जितने भी लोग चैट बॉक्सेस में हैं, तुम्हें लगता है कि मेहनत कर रहे हैं कि अभी गुंजाइश बाकी है? अपने आप को ईमानदारी से पूछना कि आर यू रियली स्टडिंग द वे यू शुड बी स्टडिंग, और स्टिल यू आर वेस्टिंग टाइम. सबसे बढ़िया मोटिवेटर तुम्हारे अंदर है इस समय, उसको निकाल लो. बिलीव मी, अपने आप एंजाइटी कम होना शुरू हो जाएगी. संदीप सर,
What Rajiv sir basically said is, तुम किताब को देखते रहोगे तो तुम्हें एंजाइटी होता रहेगा. किताब पढ़ने में बिजी हो जाओगे तो एंजाइटी चला जाएगा. एंजाइटी के लिए टाइम ही नहीं है. See, if you keep thinking, how am I going to do the notes, then you will feel anxious. If you start reading the notes, then you will be focusing on reading. And Priyansh sir had some technical issues. Sir is back. Sir, students are bombarding. Can medicine be revised in 3 days, sir? And should they revise at this moment?
अगर से पहले पढ़ा है तो रिवीजन हो जाएगा. नहीं पढ़ा है तो सर कैसे करेंगे सर? So then if you have done the earlier, then definitely it's doable. Even in 2 days it's doable, but if not, then let's find out the important core areas that what they regularly ask. For example, pheochromocytoma, sarcoidosis, pneumonia, these common topics they are commonly asking. So then you just focus on those areas. So एक्चुअली अगर हम कुछ पढ़ के जाएंगे ना, तो एटलीस्ट हमें एक होप रहेगा कि मेडिसिन का जैसे क्वेश्चन आएगा हमें डर नहीं लगेगा, नहीं तो ऐसा लगेगा फिर मेडिसिन आ गया, फिर मेडिसिन आ गया, और जो नहीं पढ़ के जाते हैं वो फिर ऐसा लगता है वही ज्यादा पूछ रहा है वो. तो एटलीस्ट हम कुछ पढ़ के जाएं. And that if you have not done, then yes, obviously in this hit program, then just one day we'll be covering the entire medicine, and that will be good enough. If you have not prepared, then it will bridge the gap that is there, sir.
So, sir, Khalil sir, controversial question coming your way, sir. I am a student. I'm not very happy with the current preparation level, and I'm not happy with my current source. Do I have time to read the source right now, or should I stick to whatever I have read? This question has been similar question asked in comment box also. That has been posted in Telegram group also. Sir.
Actually, sir, I am not a very. I feel content can be learned in multiple places, multiple times. Concept same hota hai. I am not a very fond of sticking to one particular way because exam में भी अलग तरीके से पूछा जाता है. So if you are not convinced with one source and you want to look into other part and you're comfortable with that, I think that is always a good decision to do. You should not be so worried about it. As long as your learning is happening, if you're feeling that it has improved your knowledge, it has improved your strike rate in the questions, right? It is always a good decision to make that thing. But don't look for superficial content as your main source of preparation. होता क्या है इस जर्नी में सेम टॉपिक्स को अगर आप 3 hours की रेडियोलॉजी वीडियो देखोगे एंड विदाउट डूइंग द कोर पार्ट ऑफ रेडियोलॉजी, इट लुक्स ऑब्वियसली द 3 hour session will look comfortable, easy, and lot of details will be missed out. So based on what your preparation level is, if you're already studied radiology and you want to see that you have a confidence in it, please do stick to your main notes. But अगर आपको लग रहा है कि नहीं पढ़ा है आपने और आपको एक सका से समझ नहीं आ रहा है, नोट समझ नहीं आ रहा है, it is always wise enough to just change the thing and see if that is helping you to score better. And changing source is not going to matter much. Whether I teach epidural you hear epidural anywhere, it remains the same. Just the way you listen to it, the way you understand it changes. But on the exam, when you see the question and stuff, you'll mark it. You'll mark that craniotomy has to be done. So these are all the things that you'll always do. So if you're not able to, you can definitely look into it. And I think at this point of time, going for a lot of video lectures से ज़्यादा अगर आप hit program और QRP programs करोगे at this point of time and add more questions is going to be more rather than trying to add off too much of theory or videos at this point of time. Don't overburden it. These short sessions will give you a different perspective as well as complete your work.
Thank you so much, Khalil sir. Rajiv sir, students are asking, sir, I want to score 200 plus. Any tips and suggestions from your end? 2 people have taken your name and specifically asked you, sir. 200 plus, sir.
आ जाएंगे 200. बहुत सारे लोगों के आए. लास्ट टाइम इतने बच्चे पढ़ने वाले थे कि मैं अभी हम लोग अभी मीट में गए थे, राइस की मीट था, तो मतलब 300 प्लस स्टूडेंट्स स्कोरिंग 200 प्लस मार्क्स, द वेरी गुड साइन. आप मेहनत करते रहिए, आ जाएंगे नंबर आ रहे हैं लोगों के. द इंपॉर्टेंट थिंग इज प्रैक्टिस द क्वेश्चन. मेडिसिन में सिर्फ पढ़ना अलग चीज होती है. When you do the differential diagnosis yourself, then you start getting better marks. तो मैं हमेशा बोलता हूँ मेरा बिगेस्ट ट्रिक है, नंबर 1, रिवाइज फास्टर. आप स्लो रिवाइज कर लो या फास्ट रिवाइज कर लो, बोलने की स्पीड बराबर है. मल्टीपल क्विक टाइम रिवीजन विल बी बेटर देन सिंगल टाइम टेकिंग रिवीजन. आप एक बार बहुत देर इस मार दा कॉमा फुल स्टॉप याद कर रहे बैठ के, नहीं आने वाला वो सब. ये सब्जेक्टिव पेपर नहीं है. 4 चॉइस सामने लिखी हुई है. ये सर्वाइकल वर्टिब्रा सबलक्सेट कर गया एडिनोइड करते हुए, सिंड्रोम का नाम बता दो भाई. ग्रिसल है, ऑटनर है, गट्समैन है, हार्टमैन है. तो एक बार ग्रिसल पढ़ा होगा तो 2 बार देखा, तीसरे देख के याद ग्रिसल ही था पक्का. थोड़ा पढ़ाई का पैटर्न चेंज करते हैं. हम लोग कुछ ज्यादा स्लो रिवाइज कर रहे हैं. आप पूरे नोट्स को देखना भी, किसी भी सब्जेक्ट के 30 to 40% नोट याद करने लायक होते हैं. बाकी कहानी बनाने की कोशिश है फैकल्टी की. आप प्लीज देखिए भाई, आप कुछ लैरिंग्स में 6 कार्टिलेज होते हैं, वो होते भाई. बात तो वोकल नोड्यूल की है, बात तो कैंसर लैरिंग्स की है या ट्रेक्योस्टमी की है, लेकिन बिना वोकल कॉर्ड समझाए वोकल नोड्यूल नहीं पढ़ाया जा सकता. लेकिन अगर हम पूरे के पूरे नोट्स को बच्चों की तरह याद करते रहेंगे, ये 12वीं का पेपर नहीं है सब्जेक्टिव जहां पे पूरा ऐसे लिखना है आपने फुटबॉल मैच के बारे में. ऐसा नहीं है भाई. आपको बताना कि भाई कौन उस जगह पे खड़ा था, याद करके बताओ. फोटो दे रखी होगी, नाम दे रखे होंगे, ना तो नाम पता नहीं ना फोटो पता नहीं, सब लिखा हो वहां पे. आपको आइडेंटिफाई करना है। हमारा पढ़ाई का तरीका थोड़ा सा, मैं थोड़ा सा हार्श तरीके शायद बोलूंगा कि थोड़ा सा ना हम अभी भी 12वीं वाली मेंटालिटी में पढ़े हुए हैं। शायद उसका कारण ये है कि हम जब यहाँ से एग्जाम दे गए, अब सीधे बाहर चले गए, अब वापस आए तो अभी भी 12वीं का बोर्ड का एग्जाम दिमाग में घूम रहा है शायद कहीं लगे हमारा, कि भाई सब्जेक्टिव पेपर है ही नहीं है। थोड़ा सा फास्ट पढ़ो, डरो मत। तुम्हें डर क्या लगता है कि भूल ना जाऊं? भूल तो वैसे ही जाना है, चिंता मत करो, डोंट वरी अबाउट दैट। वी आर मेकिंग स्मॉल स्मॉल इंप्रेशन। जब 3-4 हेजी इंप्रेशन होते तो डार्क इंप्रेशन बनता है। हेजी इंप्रेशन तो बन ही रहा है ना भाई, बार पढ़ने से एक सिंड्रोम का नाम, एक साइन का नाम याद हो जाता है। हमारा क्या होता है कि हमने एक ही बार में अच्छे से याद करना है, अच्छे से भूल भी जाना है उसको, नहीं होता।
Agree, sir. I think multiple fast revisions is always better than looking for a imaginary ideal revisions. Multiple fast revisions पे focus करना है. Yeah, sir. Sir, Dhawan sir, you are disconnected.
Yes, sir. Yeah. No, I was just about to finish only. Guys, मैं दोबारा बता देता हूँ आपको एक बात, ज्यादा टाइम मत लो रिवाइज करने में, फास्ट पढ़ो, क्वेश्चंस पे आओ, क्वेश्चन के एंगल से नोट्स दोबारा देखो। लास्ट टाइम जितने बच्चों के 200 प्लस नंबर आए, वन कॉमन फैक्टर वाज दे वर एक्चुअली डूइंग लॉट ऑफ क्वेश्चन, लॉट ऑफ जीटीस। डोंट रन अवे फ्रॉम ग्रैंड टेस्ट और क्वेश्चन में मत भागो भाई। इन्हीं क्वेश्चंस को, इन्हीं नोट्स को जब आप क्वेश्चन के एंगल देखोगे, ये अलग मीनिंग और अलग मार्क्स दे जाएंगे आपको। तो इसलिए आप trust me on this, 30 to 35% data of the full notes is worth remembering. Rest you can just review. So let us decide 3 speeds for our notes. Some are just quick, 80 kilometer per hour. Just see the like 3 technical exam in larynx is just like everybody knows, like just see the name. But after that, like 40 kilometers is like slow down. Like for example, the parts of supraglottis that you see. But then come laryngocele. Now slow down to 20 kilometer per hour. Price's sign, exhale valsalva. लेकिन जल्दी चलते हैं इसको यार, बहुत टाइम मत लगाओ। दोबारा पलट के आएंगे, 2 रिविजन्स बिफोर 15 जुलाई खत्म कर लो, और बाद में लास्ट में एक लास्ट टुक लेंगे। मेहनत करेंगे तो होगा, पढ़ेंगे तो होगा, टिक के बैठेंगे तो होगा, सोचते रहेंगे तो नहीं होगा। मैं अपने पुराने नोट्स को करूं या नए नोट्स करूं? भाई पुराने नोट्स में भी लिखा हुआ है बहुत कुछ, हमने उसको शायद ढंग से पढ़ा नहीं है। बार बार सर ने क्या बोला, सोर्स चेंज नहीं करो। अगर अच्छा नहीं लग रहा तो चलो ठीक है, समझ आती बात, वरना उसको पढ़ लेते हैं। और जितने लोग सेकंड टाइम, थर्ड टाइम, फोर्थ टाइम, फिफ्थ टाइम, सिक्स टाइम एग्जाम दे रहे हैं, मेरी हाथ जोड़ के रिक्वेस्ट है, जिन सब्जेक्ट्स में कमी है, प्लीज एक्सेप्ट दैट वी आर नॉट सफिशिएंटली प्रिपेयर्ड फॉर दो सब्जेक्ट्स। उसके लिए नए सिरे से बैठ के सब्जेक्ट की तैयारी करने से वो जो डिफेक्ट 135 के बाद बचा हुआ है तब जाके भरेगा। मेरे की वेट करते रहते हैं कि शायद इस बार वैसे क्वेश्चन है। क्वेश्चन आगे बढ़ रहे हैं, क्लिनिकल हो रहे हैं, हमें भी आगे बढ़ना पड़ेगा। Sandeep sir.
Very aptly summarized by all our teachers here, all the faculty here. Dr. Priyansh, I first time move to you, sir. Sir, कुछ आप summarize करना चाहेंगे? एंड बार बार 2 स्टूडेंट्स आपका बार बार नाम लेकर पूछ रहे हैं, सर मेन वीडियो देख लिया, आपका क्लास लगा लिया, कैसे रिवाइज करें मेडिसिन एंड बायोकेमिस्ट्री को सर? These and some parting comments, sir. Sir, you are mute, sir. Priyansh sir.
सर मेडिसिन बायोकेम तो हम बहुत सी बार डिस्कस कर चुके हैं सर, एंड इट्स ऑलरेडी आंसर्ड कि ट्राई टू फिगर इट आउट। इट्स नॉट कि हमको हर वर्ड बाय वर्ड याद करना है, एंड इट्स वंडरफुल लाइन सेड बाय धवन सर कि वो भूलने की स्पीड जो है ना, धीरे पढ़ोगे फास्ट पढ़ोगे भूलोगे उसी स्पीड से। इट्स अ वंडरफुल लाइन एक्चुअली। तो आप है ना फटाफट पेज पलटो खाली, और बार बार उसी पेज पे वापस आने की कोशिश करो। जितनी बार एक्चुअली में हम देखेंगे ना तो ऑटोमेटिकली याद हो जाएगा। एंड particularly the subjects which is very volatile, biochem, pharma, micro, and not me, the more you see them, the more you will remember. धीरे धीरे पढ़ने से याद नहीं होगा, बार बार पढ़ने से याद होगा। सो डू दैट, एंड इट्स जस्ट अ मैटर ऑफ 80 days। टाइम तो देखो कैसे भी निकलेगा, बहुत मेहनत करेंगे तो भी निकलेगा, सोचते रहेंगे तो भी निकल जाएगा। तो लेट्स स्टार्ट डूइंग। क्या होगा कितना होगा वो वक्त बताएगा, हमारा काम है करना। आप खूब मन लगा के, खूब मन मार के जो भी है आप पढ़ो खूब, एंड इट्स जस्ट अ मैटर ऑफ टाइम। जिसने 80 दिन अच्छे निकालेंगे हम आराम से पास हो जाएंगे। सो ट्रस्ट योर सेल्फ, बैक योर सेल्फ, एंड वी ऑल आर विथ यू। इफ एनीथिंग इज देयर, कुछ सब्जेक्ट में कहीं वीक है तो आप यू कैन सी द वीडियोस ऑफ हिट प्रोग्राम दैट विल इट्स गोइंग टू एटलीस्ट कुछ तो आ जाएगा हमें उन सब्जेक्ट का, एंड दैट इज गोइंग टू बी द एसेंस ऑफ दैट सब्जेक्ट दैट यू आर गोइंग टू कैप्चर इन दैट शॉर्ट स्पैन ऑफ टाइम, एंड दैट विल बी हेल्पफुल। विश यू ऑल द वेरी बेस्ट, and thank you sir, thank you for the time, thank you sir.
Thank you so much, sir. Khalil sir, any parting comments and last minute suggestions? Like,
Yeah.
obviously, we'll be coming again, sir, to as the days pass, we'll be coming
Yes.
again. But, sir, for now, anything you want to add to?
Yes, sir. Well, I would say, utilize this 1 month to finish your pending subjects, and start aggressively on the questions. The more questions, the more accuracy you will have. And as sir said, start doing more GTs and enjoy this journey. I mean, this is a challenge that is there, right? And jitna determined effort aap karoge, and with whole heart, you should also feel proud of this efforts that you're doing. This, and you're doing it to become a better version of yourself, and do this with good heart, good faith. एक अच्छी उम्मीद से काम करना इक्वली इंपॉर्टेंट हो जाता है कि गुड रिजल्ट्स आएंगे, एक अच्छी उम्मीद लेके चलना है। परेशान होके, वरीड होके, नेगेटिव थॉट्स लेके घूमेंगे तो वो और ज्यादा एंग्जाइटी बढ़ेगा। एक अच्छी उम्मीद, यस, दिस इज द एग्जाम दैट आई वांट टू क्लियर, एंड बी हॉनेस्ट विथ योरसेल्फ दैट आर यू डूइंग योर 100%. I think you will all do well. Everybody has cleared the exam, except people have taken some time, but everybody, most of the students who have sticking to the process, trusted the process and worked through, have done this exam well. So please do not get disheartened. Give it 100%. Acha time hai. Even now we are talking about 2 months, 2.5 months now from now, right? Wonders can be done in this time. I have seen students coming very late to these sessions, like joining very late also, in mid-August and stuff, or late October, and clearing in the first attempt, right? So this is all possible. 2 months are good enough time to change the trajectory. Have faith, have good hope, and give your 100%. Best wishes to all of you. Yes, sir.
Rajiv sir, over to you, sir. Then in the end, I'll just answer a few questions hurriedly. Rajiv sir, anything to add? Sir?
Yeah. The last thing I'll say, abhi achhe din, lot of days are there with you. Don't think that we're talking about last one leg of preparation. This session was designed just to make sure that you put these 80 days to best use. Our endeavor is to make sure that wherever you feel that you are not prepared enough for the subject, we want to help you out. That's why the quick revision program or quick revision program videos or HIT program and the QBank. Again, I would like to say, because we somewhere are very, very happy with this, that our faculty has created the QBank in the app themselves. And we want to really, hear from you guys also. You solve the question. If you have any query, you text us that we would love to send you audio note for that. Why it is so if you don't understand that. The last thing I would like to say, that rather than anticipating what can go wrong, let's do the right thing. Rather than wasting time, let us increase the number of hours we put in. लेकिन ये सब बातें कहने की हो जाती हैं जब उसको प्रैक्टिस में नहीं डाला जाता। देखिए, मैं हमेशा एक बात में, मुझे आज तक शायद मैं मोटिवेशन मुझे समझ नहीं आता इसलिए, क्योंकि मैंने कभी सुना नहीं, शायद किसी डॉक्टर खलील बोलते तुम किसी को नहीं सुन देता हूँ, तो इट इज प्रॉब्ली लाइक माई हैबिट। मतलब मैं हमेशा बोलता हूँ कि हर बंदे, हर इंसान के अंदर रियल मोटिवेटर छुपा हुआ है, तुम्हारे अंदर है। अगर मैं स्टूडेंट होता और तुम यहाँ बैठे होते, मुझे क्या बोल रहे होते बताओ, कि भाई पढ़ लो, पास हो जाओ, यही बोलते ना। लेकिन करना किसने? तुम्हें। हम, वी कैन टेल यू दिस द राइट थिंग, बट टिल द टाइम यू डोंट टेक इट ऑन योर सोल कि मुझे पढ़ाई पूरी करनी है। खलील सर ने क्या बोला कि भाई कर लो, बाकी देखते क्या होता है। और रियली वही एटीट्यूड काम आता है। वो एटीट्यूड हमें सिली मिस्टेक से बचाता है। वही एटीट्यूड हमारे से आंसर चेंज नहीं करवाता कि भाई अपने लिए रिस्पेक्ट होती है, भाई पढ़ाई करी हुई, जो आता है वो देख लेते हैं, नंबरों में कन्वर्ट हो जाएगी, और दैट इज सफिशिएंट टू पास द एग्जाम। My dear friend, 150 out of 300 without negative marking. The system wants you to pass the exam. Please understand that. 100 क्वेश्चन तो नोट्स से आएंगे, no doubt about it. अगले 140-150 क्वेश्चन में काफी नंबर निकाल के हम पास होते हैं। डॉक्टर धवन, फिर क्यों नहीं पास हो रहे? अगर आप ऐसे बात बोलते हो कि भाई ऐसे 100 तो आ ही जाएंगे, हम 5 सिली मिस्टेक नहीं करके आ रहे, 20-25 सिली मिस्टेक करके आ रहे, 20-25 सिली मिस्टेक करके आ रहे हम लोग। क्यों करके आ रही? क्यों? मैं थ्योरी से प्यार हो जाता है। मेरा पहला और अंतिम प्यार ही थ्योरी है। क्वेश्चंस तो बेगाने हैं, जीटी तो बिल्कुल ही बेगाने हमारे। जीटी डर लगता है सर, जीटी देते मेरा दिल टूट जाता है। भाई दिल को टूट जाने दो एक बार, मैं कहता हूँ टूट ही जाए तो बेटर है, तोड़ के जोड़ लेते हैं एक बार भाई। वो ये जीटी का डर क्यों है भाई, मुझे समझ नहीं आती। ये जीटी एनबी ने बना रखे। दीज आर असिस्टिव टूल्स टू मेक योर जर्नी द बेस्ट ऑन द एग्जाम डे। और हम जीटी के नंबरों को लेके ऐसा 3-4 दिन चद्दर तान के सोते हैं कि मेरे को डिप्रेशन हो रहा है। ये बहुत प्यारी इन्वेंशन है यार, मैं बता रहा हूँ। ये जितने भी, कभी देखा किसी रिक्शे वाले को डिप्रेशन हो रखा हो? अभी बाहर जाना, घूमते फिरते, बाहर जाना, चाय पीते, एक रिक्शा वाला पकड़ के लाना, मुझे डिप्रेशन हो रहा है भाई, उसका खाने का नहीं हो रहा भाई. डिप्रेशन इज अ लग्जरी ऑफ द फुल स्टमक, प्लीज अंडरस्टैंड दैट. जब खाना वाना अच्छा मिलता, घूम रहे हम लोग, बातें कर रहे, इंडिया पाकिस्तान पर अटैक करेगा, पाकिस्तान इंडिया पे रहेगा, बहुत मजा आ रहा है ना, क्योंकि ये तो अफीम है ना. अपने गोल से दूर भटकते रहो, बातें करते रहो, नहीं होना यार, डर लग रहा है यार, डर. ऐसे करने से कहाँ हो पाता है? करने से होगा, सोचने से नहीं होगा. जितनी मर्जी बातें कर ले, हम भी कर ले, तुम भी कर ले, जब तक तुम रातें नहीं जागोगे, नींद नहीं जागोगे और पढ़ोगे नहीं, तो ऊपर वाला तो देखता है भाई, ऊपर वाला जजमेंटल है. पता नहीं किसने बोला बहुत काइंड है, काइंड है, काइंड है. पता कब काइंड है? जब 148 तक हम पहुंच जाते हैं, 2 नंबर दे देता है, पास करा देता है, वो काइंडनेस है. 148 तक की यात्रा आपकी तुम्हारी अपनी है. तो इसलिए अपने हाथ पैर कस लो. पढ़ाई मन से ना हो पाएगी, पढ़ाई मन मार के होगी. तो इसलिए मैं तो आई एम नॉट हियर टू पैम्पर यू, आई एम हियर टू टेल यू वेयर एवर वी आर गोइंग रॉन्ग, लेट्स करेक्ट दैट, because the whole team of doctorals want only one thing: may you all pass the exam with good score, and you can do that, and these 80 days are sufficient for that to happen. Sandeep sir.
Thank you, sir. Sir ने बहुत अच्छी बातें बोली हैं. I will just summarize what all these faculty members have said and some common queries. Some of you are joining in now and you are asking the same questions again. If score is stuck between 130 to 140, क्या करना है? Identify what were the areas which were lacking, any subjects you had left. If you had not done PYQs or PYT, focus on that. Details Rajiv sir has already said. So ये video जब जाएगा, please listen to the video again instead of asking the question 15 times. Sir has already answered it. So listen to the video शुरू से. Second thing, how many questions per day should I try? Again, varies from person to person. If you are doing theory along with MCQ practice, somewhere between 50 to 100 questions with explanation is a good number for now. If you are not doing theory and it's purely MCQ day for you, then about 150 questions minimum you should be solving, and majority of the explanations also you should be reading. So that answers your query. Is QRP 5.0 enough? It's a revision program. If used along with PYQ and your existing notes, whatever place you have joined and prepared notes from, yes, QRP 5.0 should be enough along with the two sources I said. By itself, no revision program in this world can make you pass. But revision program helps you in summarizing, increasing your accuracy if used along with PYQs. Number 4 thing, how to avoid doing silly mistake. The only way you can avoid silly mistake is multiple revisions. As Priyansh sir said, it is not the quality of revision, it is the number of revisions that you do. I say in my class also, when you are doing the first reading, it is the quality which matters, the concepts that you make. But when it is revision time, it is the number of revisions that you do that will decide how much you are able to remember eventually in the exam. And finally, HIT program details have been shared in the group earlier. They have been shared in the video earlier. If you feel that even if your 3 or 4 subjects are lacking, or you are preparing at home, discipline is lacking, HIT program at DocTutorials, you get 3 to 4 hours per day of live class of all 19 subjects by the faculty. You get QRP 5.0 access, you get grand test access, you get mock test access, and you get access to the WhatsApp groups where you can join. You can ask the faculty in real time about your preparation, about your so it's like a mentorship kind of program, helping you gain that, bridging that 130 to 150 kind of that valley which you are not being able to cover right now. So apart from that, I think most of the queries have been answered. And at DocTutorials, all of us will try to come again in the next few days and next few weeks, and we will take up. See, it is the opening thing because 80 days are yet to be done. So our suggestion is finish off the pending subjects first, then start revision. If you are done with all 19 subjects first, then the immediate revision should be started. And in case you have joined a coaching somewhere, continue with that coaching. If you feel even 3 or 4 subjects can benefit, HIT program is the curated program specially created by the faculty at DocTutorials. You can always consider. And lastly, detailed revision program, as Rajiv sir always comes up with. Sir will be coming up with. Sir, you will be coming up with it, right, sir? I think we had a talk about it also.
That's why, yeah. From 16th July to 25th July, please keep the window vacant. 25th July is a travel day, and we will make a plan till 15th July. Please cover 2 proper revisions, and after that we will have one last look. It's a pyramidal approach, and the solid foundation, as Sandeep sir said, understand one time, then as Priyansh said, multiple times see that, And the apex, the pinnacle of the pyramid would be between 16 July to the 25th July. We'll definitely keep coming back to you. Khalil sir, Priyansh sir, Nadeem sir, so many other people will be coming again at appropriate intervals to make sure that you guys are channelized in your efforts towards passing the examination. And just have one thing clear in your mind, that each one of us is like very keen to help you in whichever ways and means possible. Sometimes we're not able to answer the queries, we do know that, but wherever possible we try to leave the audio notes and like the explanation also of the question. But keep learning. But you are the person who is going to execute. Today, look into the mirror and say, the whole world keep telling me what is right, but it's now my turn to do the right thing.
Very rightly said, sir.
Thank you, sir.
So it's time for us to put this session to the end, and most of the queries have been answered. We'll come back again. Thank you, Khalil sir, for your time. Sir was traveling and sir could take out time for us. Dr. Priyansh is not in the country right now. Sir is joining from a different time zone, from a different country for us. And I've just reached home today after traveling outside. And Rajiv sir, again, sir was busy with the classes, but we at DocTutorials will be coming up. And you are most welcome to post any queries if you have in the recorded comment section of this video, and you can message us individually also. We'll reply to you, and in the coming days we'll take up your queries also in the coming video. So thank you so much. Thank you, sirs. Thank you so much for your time.
Thank you very much.
Thank you, sir.
Thank you, sir.